the scale of media attention during that time, I mean, it was on national news. You would go from a boardroom or a conference room where you would have a conversation of how something would be handled, and then you would turn and that would be broadcast across CNN or MSNBC almost instantaneously. It was announced.
Clock in, scrub up, and join us behind the red line. You're listening to First Case, a perioperative podcast bringing you exciting interviews, engaging discussions, and innovative solutions that are changing the way patients receive surgical care. Each episode, we talk to frontline staff, perioperative leadership, and nursing entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the back table to the boardroom, from wheels in to wheels out, we tackle the real-life issues affecting the OR. Whether you're tuning in for surgical service education or inspiration, we're glad you're here. And now, it's time to roll back and start the first case.
On this week's episode of First Case, we're speaking with Derek Trabon, Director of Emergency Management at the University of Texas at Austin, in Austin, Texas. And Chris, it's really interesting that last week we talked to Joanne Langen, and then this week we're talking to Derek, and both of them had major changes in their life because of 9/11, as many of us did who lived through that time, for sure. But to see the trajectory of their careers based on that event and how they have now put their lives into this career of disaster preparedness and emergency management. It's really interesting to have two guests back to back that have that same impetus that changed the focus of their lives. And I'm really excited to hear how he made a positive out of such a negative experience.
And how he's able to share that with others, because it's those experiences that we're going to learn from and hopefully be able to handle the next thing that happens in an even better manner. Because as everybody has said, it's not if it's going to happen, but when. And hopefully we can use these tools to prepare. And here comes Derek.
Absolutely. Don't go anywhere. We'll be right back with Derek Trabon.
Hi, I'm Chris Blevins.
And I'm Melanie Perry.
From the studios of Healthcare HQ, you're listening to First Case.
Joining us now is Derek Trabon, Director of Emergency Management at the University of Texas at Austin in Austin, Texas. And Derek, thank you so much for joining us today.
Thank you for having me on.
I'm so excited to get to talk to you. And, we actually got connected through another podcast guest when we were recording season 11. Jessica Hovland was on the show, and we got to chit-chatting after the episode had recorded, and I was telling her about our next season, and she's like, oh, I know exactly who you need to talk to. I've got to connect you. And I absolutely love it when our podcast guests give us our next season's podcast guests and those connections that we can make just through the beauty of a network and through the beauty of getting to know people. So I am really excited that you agreed to join us today, and I'm really ready to just dive into this conversation. But first, why don't you just go ahead and introduce yourself to everyone?
Yeah, thank you again for the time. And I think that's great to hear that the relationships at UT have continued to be as good as they are and even better in the future. It's been a pretty active almost 2 years that I've been at UT. And for me, this is sort of my first time working in higher education exclusively. So I'm originally from Kansas City, Missouri, born and raised about 2 miles away from Arrowhead and Kauffman Stadium. So big Chiefs and Royals family.
Go Chiefs.
Chris is going to be your best friend.
And I left home when I was about 19 and decided that in my mind, at least at the time, I was a career military person. That's exactly what I wanted for many years. And so I followed that dream, went to Fort Benning, Georgia, home of the infantry, went through infantry training. So that was my job. And then I found myself living in Washington, D.C. for a little over 3 years and training time included. And really, that's where I sort of had a shift in my life. What I thought I wanted to do completely changed. And that was after September 11th. So it's tough to think about, right? It's tough to think about life before 9/11. I was thinking about, discussion topics for this podcast, and even thinking about life before COVID, sometimes we're like, wow, what was it like before then, right? And even thinking back further to 9/11, so much in our life has changed. I mean, if you fly in and out of an airport at any time, it's changed, right?
We all think about 9/11 if we were alive, when that happened, and when we go to an airport and we can see the effects of September 11th and how things have changed. And I'm really curious for you, how did 9/11 change your trajectory, change your perspective on what you wanted to do with your career, and just what happened?
Yeah. So I was a part of the 3rd Infantry Regiment, which is the oldest active infantry regiment in the Army. It's also known as the Old Guard. So this is the unit that has the Tomb of the Unknown Soldier, the drill team. They work a lot out of Arlington National Cemetery. And just by luck, I landed in a company that worked mostly out of the White House and the Pentagon. So I had a chance to work there for almost all of the time that I was stationed in DC. September 11th, so our base is connected to the cemetery, which is just across the street from the Pentagon. So when everything happened in DC, it didn't take long for the word to travel over to the base. And I think our Charlie company was there the day of, and then slowly other units from our base started to arrive the next day. And we were there for the better part of, I would say, revisionist history. It's the details kind of, fade sometimes, but I think we were there for over 2 months dealing, supporting what was happening with regard to, securing the location or removing, rubble and debris. And, of course, you run into things like remains and recovery of those and all of that. So did that for about 2 months. It was such a great experience to feel like, I think at the end of the day, just a day-to-day job, sometimes you think, what have I done that's made a difference? What have I done that's, especially when you find yourself shuffling paper around and you're like, what did I really do?
What did I really do? Yeah.
How many Zoom meetings was I on today? And did I actually do, right? I feel that. Yeah.
Exactly. So every day there was
right.
a contribution. You're contributing, you're doing something, right?
Yeah. I was just curious because I come from a military family. Melanie does too. And we know how much training and preparation is a part of your daily life in the military. And I wonder, with all the training that you all did, and then when you finally are putting some of that into action after 9/11, do you feel that had maybe just some influence on your transition into emergency management, because that's your job, right? Is to prepare for an emergency. I mean, do you think that made a big difference in what you're doing today?
Yeah, it was the sole reason why. Yeah, it was exactly the reason why I still do what I do today.
Do you think all that preparation worked? By the way, just curious. I know, it's 9/11. It wasn't anything we expected it to be, but do you feel like you were prepared in any way?
You know what? I don't know if anyone has ever asked me that question. I'll be perfectly honest with you. And I don't think anything really prepares you for a day when all air travel is grounded, right? You don't see anything in the sky. Everyone is at home watching the TV. There's no traffic. And in DC, no traffic. That's unheard of. Right. And so
that's not, no kidding.
Yeah.
Nothing prepares you for that. And I would say there's definitely a certain level of training, from the military that teaches you, I don't know, how to adapt and overcome, right? How to adjust with the situation that's evolving. So much of what I do now is information gathering, understanding intelligence that you have, whether it's incomplete. Oftentimes, the information that we have when we're responding to an incident, you're trying to make informed decisions, some of those very tactical, and the information is incomplete or it's wrong, or it's changing so quickly, you're trying to get ahead of it. Y'all can relate to that, I'm sure, from, having cases where, a patient's stable and then they start to decompensate or something something even worse
Sure.
is happening.
Or we think we're doing one surgery, and then you open up a patient and you realize, nope, we're about to have
Doing
to
something
pivot
different.
and do something completely different.
Yeah,
Sure.
no, totally. And I think about you talking about, obviously nobody could ever have been prepared for what you experienced 9/11, and your military training, obviously it was the best training you could have at the time, but that doesn't necessarily mean you were prepared for the situation that you were in. But after that experience, you took what you had experienced and incorporated it into your career, and you have been doing emergency management, disaster preparation since then. And I'm curious, where did you go after 9/11, after the military? What other emergency management activities were you involved in?
When I decided to separate, I felt drawn to this. It was something that I wanted more of. It's almost like you can't get enough of it. And so my goal was always to go to college at some point, and the military provided that, the means to do that. But at the time, I was separating at the end of 2003, beginning of 2004. There were not many programs at an academic level that focused on this career field at all. And so I found one at the University of North Texas, Go Mean Green, and that's where I decided to move. So I moved to Denton, Texas. Always wanted to live in Texas. Always loved the state of Texas. And so that was all the reason I needed.
As do all of us on this podcast.
Yeah, right.
You're talking to a bunch of Texans, by the way. So, yes.
I'm all hooked 'em today. So,
yeah.
Thank you. Yes.
So,
but keep going.
So, yeah, I moved, started going to school and figuring out exactly where I wanted to go. There's so many offshoots in the industry of, in this field, I guess more specific of an industry that you'd like to get into. So emergency management, and also there's a related field called business continuity that folks tend to take different routes with. So for me, it was not really clear early on. And while I was at North Texas, I was working at Medical City Denton and just working in environmental health and safety. And at the time, it was just the job that I could find that paid the most in a college town. So I didn't have really any desire or intent to work in a hospital, but it was just the foot in the door, right? And then after that, I got a job with Medical City Arlington, and they were looking to hire someone because the city of Arlington was getting ready to host the Super Bowl. And so that I made my way over there and graduated, finished my bachelor's. At the time, I was kind of, wanted to pursue this and move into healthcare, but I was also really missing being in uniform. And so I re-enlisted with the Air Force this time, with the National Guard, the Air National Guard in Texas, the 136 Airlift Wing in Joint Reserve Base Fort Worth. Incredible unit. And I had a chance to do emergency management, which is exactly what I wanted to do. So I was kind of...
Oh, and I bet you were very happy.
Yeah. Very happy, very different life, National Guard versus active duty Army, but incredible unit. And so I was really in my civilian career and in, sort of this part-time capacity doing the same job. So I did that for a few years. Well, civilian world, Air Force was 6 years, a 6-year commitment. So in my civilian career, I went from the hospital environment to working for a nonprofit group, the North Central Texas Trauma Regional Advisory Council. Spent some time there, had an opportunity to work with the development early stages of the Emergency Medical Task Force. So this is a group that's funded by the Department of State Health Services. And the mission was to create, roster, and deploy medical assets throughout the state of Texas. So nursing strike teams, mobile field hospitals, mobile medical units, ambulance strike teams, and buses. So multi-patient vehicles that can accept, depending on staffing, around 20 ALS level patients.
Chris, you speak in your language. That's right up your alley.
I know. So, Derek, I was actually the medical liaison for the Ellis County CERT team in Dallas, in the Dallas, Texas area. And so we actually worked quite closely with some of those mobile teams
we probably
some training exercises. Yes, sir. I bet we have. So that's really cool. But also in Texas, you had some experiences during the Ebola crisis, if I remember correctly. And I was wondering, would you mind telling us a little bit about that experience? I think that's really interesting along that pathway too.
So from the time I was with the Trauma Regional Advisory Council, the RAC, leaving the Emergency Medical Task Force, I really wanted to be back in an acute care environment, back in a hospital. I think it just gets in your blood at a certain point. You love working in hospitals. They're always alive. There's always things happening. The doors never close. And, I feel like people are just drawn to that. So when the opportunity was there, I worked for a company that was contracting work for Texas Health Resources. So, Chris, you probably know THR. And one of the hospitals was...
I do. I do know THR. It's a great health system. So,
yeah. And the timeline for that specific event was, I think, September, October of 2014. And I think what a lot of people, it's been long enough now to where that event isn't as in the forefront of people's minds. I still talk to people now, especially living in Austin, and I talk about the Ebola incident, and so many people don't remember or never really were paying much attention. I mean, if you lived in Dallas or any of the surrounding areas during that time,
right,
you absolutely knew what was happening at Presby Dallas. But what most people don't understand is that has always been a quality facility, top-notch patient care. I mean, they have, I think at the time, their magnet certification, I think they were going on their 4th year. So quality nursing, overall, just an incredible facility to work at. It makes you think, this could have happened, that event and the way it transpired could have happened at any facility, any hospital in the United States with, maybe aside from, a handful that would have handled it any differently. I mean, it was a major undertaking.
Well, it's a big eye opener, right? Because anybody could be affected by anything. And we know that by COVID now too, right?
Right. Yeah.
You're exactly right.
So I'm curious, how did the hospital handle it? How did they manage that?
It wasn't easy at first. And it taught us a lot of lessons, I think, from the perspective of managing a program like this for an inpatient, acute care facility. You're dealing with government agencies, you're dealing with external agencies and factors outside of your control. And also, I think what Melanie and I talked about when we first met was a hospital is a fixture of the community, right? And if the community begins to lose faith in it, that's a very dangerous position to be in. At times, right, especially in an incident like that, you are so guarded with the information of what's happening because things do happen so quickly, right? And there are many complexities that are involved in that. And it was a challenging time. Certainly was.
No, I was thinking also, don't y'all have to worry about media too? Because when you have something like Ebola and those are big headlines, the hospital system might be trying to do everything right. And you have to try to have time to figure out what the parameters are. But then you have the media that's trying to sensationalize things. I mean, I was in Dallas then. I remember it's scary because they're trying to nitpick. At the same time, you're trying to do everything right, dealing with something that you're like, this doesn't happen in America. And at the same time, it makes it scary. And then of course, then we find out COVID, here we go all over again.
This is the world before COVID, right? And I don't think there was as much of a focus. I'm sure there was a focus for certain groups around travel history, where this person is traveling from, where they've been, what they've been exposed to. And we look back, now in the lens of, post-COVID or still even, in a state of still dealing with COVID. And it's hard to think about that, right? About what was our universal precautions then? What was our travel screening like then? Those things just weren't as common or maybe as as aware as they should have been. I would say, the way Presby handled it, they really worked around the clock to take care of their patients and their staff. That was my experience. I mean, it was a massive undertaking for that facility. You're dealing with things like you mentioned, Chris, the media. I know that there were many instances where reporters were trying to gain access into the hospital, and they were saying that they had symptoms similar to Ebola so that they could enter the facility and make observations of how the staff were donning and doffing PPE and triaging patients that were coming in. And then at the same time, being that sort of, I don't know if the right term, if it's an acceptable term, the scarlet letter, but you are tagged, like you're the facility, you are it. So anyone that has symptoms after that, guess where they're going, right? They're not going down the street. There was even some efforts of standing up more of an assessment and treatment facility during that time. But from the time that it happened, and then our 2 nurses had contracted Ebola virus disease as well, there wasn't enough time really. I think we were far enough along the course of the response that we had managed it. And then, of course, both the nurses were transferred out. It's crazy, right? It's
so unfortunate.
The scale of media attention during that time. I mean, it was on national news. You would go from a boardroom or a conference room where you would have a conversation of how something would be handled, and then you would turn and that would be broadcast across CNN or MSNBC almost instantaneously. It was announced.
Those are not. That's not your 5 seconds of fame you're kind of hoping for, right?
Yeah.
It's not at all.
But this brings up a very important topic that we didn't actually address this season, other than talking about it right now. But yes, people want to know. Yes, the media is there to get information out. But how often can the media be a hindrance, or can they make things worse? And I've brought this incident up several times this season, but when we had a shooting at work, and it's like as soon as it got out on the, you call 911 and it gets out on the phone lines, and then suddenly the news knows about it, and they're out there trying to get as much information as they can, taking pictures through windows and all this stuff, and having a plan in place to manage the media. I think it's just as important as having a plan in place to manage the disaster itself. And I don't think we talk about that one as much as maybe we should, but you bring up a really good point.
No, it's a really good point. It's a fundamental part of what we do in emergency management is having media staging, having a designated location, having a public information officer, having someone that has that message and can relay that. And it's oftentimes
is the designated spokesperson.
Right, exactly. And in situations like this, they want someone in a lab coat and scrubs. They're not looking for someone who is through HR or through communications. They want someone who's clinical, right, to be able to speak to it. That's right. I would imagine it would be the same as an airline incident. They would want a pilot or someone, to speak on behalf of what the crew do.
Right.
Okay, so Derek, I'm curious because you have a ton of experience in emergency management, going all the way back to a very traumatic introduction to it back at 9/11, and then through your different roles in Texas and the other companies, other places where you have worked. But now with your role at UT, you also get to educate nursing students about being prepared. And I'm really curious, what is it that you teach them? I would like to know myself so I can be prepared too.
Yeah, we're taking notes.
Yes.
Yeah, we're very fortunate to have the relationship that we do at UT with the School of Nursing, the incredible faculty there. It's such a close partnership. And it's one, as you can imagine, it's one that I've cultivated even more over the last almost 2 years that I've been there. I come from a family of nurses, by the way, so I'm a little biased for my
Well, we are awesome. We know.
I do have a passion for nursing because I think in what I do and what nursing and emergency management seem like they're so closely connected because we're caring for those that can't care for themselves. And we're focused on vulnerable populations and the indigent and the people who are underserved and in most need. And so sharing what a new graduate nurse should expect, right? And I don't remember the exact percentages of graduates that are going to work inpatient, so in a acute care environment, but it was high. And so sharing with them, here are the things that you need to know. You all know this better than I do, with continuing education requirements, annual training requirements, not only from the organization you're working at, but just for your license, for your profession. There's so much education that's required. This is something that oftentimes gets placed on the back burner, right? And then when you need it the most, it's something that you've really very seldomly ever spent time focused on. So what we do is we have We have a chance to speak didactic lecture and presentation on things that a new nurse would need to know from the lens of emergency management in a hospital. And then later in that week, we do this every semester. Later in that week, we run through a disaster day. So we have 2 different days and 2 different groups, and they spend a little bit of time. We approach this from our standpoint of incident command, emergency response, and how they interface with us. And so we go through a scenario. It's all scenario based. And then they pick a lead for the teams, and they interface with us, and they tell us what they have, what they're seeing, the victims that they're receiving. And then we give them sort of a few curveballs here and there. And then when they request resources or assistance from us, it's sort of their first introduction to what it's like responding to a disaster in a hospital. But it's an incredible relationship. It leverages sort of the side of our teaching mission at the university that we put a lot of value in, especially for the clinical, staff at the bedside.
So this season, we're speaking to a lot of people about, disaster preparedness and, being ready in emergencies. And I think often what comes up is the importance of simulation, that, in all of our hospital competencies that we have to do for our jobs and just to check that box for continuing education, so much of it's virtual, right? That you do from the comfort of your home in your PJs, but that doesn't actually prepare you for these real world scenarios. And what you've been talking about is actually getting your hands dirty, right? Making that muscle memory and how important, how are you able to really sink that into your students that's important that your body knows what to do because your brain's freaking out, right?
Yeah, it's such an important topic, and I'm really glad you brought it up. I think simulations are becoming more ingrained in clinical practice, which is exciting to see, especially the investment in time and resources into that. What you said made me think of a comment, and I'm struggling to remember exactly which incident. I think it was the Pulse nightclub shooting, but I don't recall exactly. But this is a common phrase: the body can never go where the mind has never been.
100%. I love that. Right?
You have got to train like you fight. You have got to make that scenario as realistic as possible. And oftentimes, I love ER nurses. They deal with the worst of the worst all the time, and they ask for more, it seems like, and nothing really phases them. They're just, I know this is an OR podcast, but I love every nurse, but those
That's okay.
Man, they're just on the,
we'll let the ER keep the ER. They can have it.
They're on the front line, right? But where I was going with that was oftentimes the exercises that the hospitals do, which are required by law, at times it can stop at the ER or the OR. It doesn't always make its way to med surg or PACU or administration, right? Or social work or dietary. I mean, I've had conversations with folks before, I think Melanie and I were talking about this. I had a conversation with folks at the blood bank once. I won't say which hospital, but we were having conversations around, what a disaster response looks like for the hospital and the type of blood that we would need and the information that they would need. And the answer was, well, we would need a first and last name, date of birth, MRN. And I'm like, we don't have that.
We don't have time for that.
20 people show up and we don't know anything. So what's our protocol like in a situation like that? Right? And those were eye-opening conversations to have, but through those meetings and those simulations, right? And what you're getting to really, Chris, is preparedness. Emergency prepared. So management, people oftentimes call us emergency preparedness. Management really includes preparedness, response, recovery from an event, mitigation. Also, those are sort of the 4 tenets of what we do. We have to focus as much on preparedness as we do. It's not as sexy as response. Emergency response is always going to be sexier than preparedness.
Alert. Yeah. We like adrenaline.
Right. But if we take it as seriously as we would during a response, you get so much more out of it. Right. And that's really where we tried to, at least at the organizations I've been fortunate enough to work at. UT Southwestern Medical Center in Dallas being one of them, just such a world-class institution. And the attention, the support, needed to take an exercise or a drill to that level was always there at UT Southwestern. And we learned so much throughout that process of going through designing a drill, conducting the drill, doing a debriefing, and developing an after action report. And not only developing the lessons that you learned, but incorporating them and making the change, and then following up. Does this apply to orientation? Does it apply to annual training and competencies? What actually makes a change? And you all know change management is not an easy process. And
no, not for medical people.
Right. And we've already mentioned,
we like what we like when we like it.
And we've already mentioned how little time, this subjects like these do get at times. The onus is on your emergency management staff to make sure that the drills and exercises make sense. They apply to what you're going to possibly see walk in the door or happen in the community. And also think intuitively about how you can support those that are doing the work so that they don't, have the burden of dusting off a plan that they've only looked at once a year when they're required to, and to build it almost into what they're doing at the bedside.
Change management, that's hard. One of the worst phrases that gets thrown around all the time in the operating room is, but we've always done it that way.
Oh my gosh.
And everybody loves how they've always done it. And unfortunately, how we've always done it is not necessarily how we need to be doing it in the future, or how we need to be prepared for what may come our way next. Because as we can see, things happen unexpectedly, and people find new and inventive ways to sometimes cause harm or for the disasters to occur. And I want to hit on real briefly, because we are running out of time, and there's two things I want to hit on. I want to hear your thoughts on situational awareness, and I want to hear your thoughts on, because you are in the business of being prepared and in emergency management, I know that affects you personally and how you travel. So I'm curious how you view traveling when you go personally. Maybe things you take with you or things you look for. And I know that that's kind of connected to situational awareness, but they are two different things. But I'd love to hear those thoughts before we wrap up, just to see what you think so that I can take some more notes.
Yeah, I'm about to get on an airplane on Sunday. Hook me up, Derek.
I live in a constant state of paranoia. That's just built into who I am, I think.
Okay, well, never mind. Cut that.
I think what Melanie and I were talking about when we first had a chance to connect was, so my daughter is about to turn 11 at the end of June. And what's interesting for me is to see how much, I really feel the need to make sure that she's prepared. And I'll give you an example. So when we walk into a store, we walk into Target or the grocery store, I'm always sort of having conversations with her around, if we couldn't leave the way we came in, what's another way to go? And now she just knows. She's pointing at the exit sign. She knows to the left and the right of the back of the store is probably a safe place to go, because we do live in this world of, always having you got to have an exit plan. I don't know. I think it was Mike Tyson who said everyone has a plan until they get punched in the face. And that's always stuck with me. It's not only do you have your main plan, but it's a sort of an acronym, PACE planning, primary, alternate, contingency, emergency planning. So what's our primary plan? And if that doesn't work, where are we going after that? And then if all hell breaks loose, what do we do? When I'm traveling though, Melanie and I also talked about learning lessons. A lot of what we do in this field is learning what others have gone through so that we don't have to learn those lessons ourselves. I'm sure you all, work in the same space as that. Always continual process improvement, always not only processes, but making sure that, you're aware of challenges that other organizations or communities have gone through. We've delved so much into the details, and looking at the events that happened during the Harvest Festival in Las Vegas. I mean, just incredible response from those facilities that received the victims of that really horrific event. I can't even imagine what those days were like. I think I can. I can almost put myself into that space a little, but it's so drastically different dealing with the victims in a situation like that. But one thing personally that it taught me was, if something happens and I am in some type of a mass casualty incident scenario, myself as an individual, First of all, am I going to respond? Am I there with anyone else? Do I need to take care of them first? And also, where are we going? We talked about the difference between the Boston Marathon bombing and the incident in Las Vegas, and the number of people that went by EMS, and sort of contrasting both of those incidents. And I think we're in a state now where information is so easily accessible, but we really don't understand the proper context of it. So if I'm traveling somewhere and I search hospital, what hospital am I going to get? Is it the best hospital? Is it the level 1 trauma facility or burn facility of the area? Or is it the hospital that pays, to have their name when the search result hits, they're at the top of the list, right? Right. I mean, it would make sense from a business.
Are they where I really want to go?
Right.
Yeah, right.
Yelp reviews, right?
Is it the appropriate level of care? Right. So things like that I can't stop thinking about at times. And I also travel with tourniquets also. I think Stop the Bleed training is probably the most important training course that anyone can take. It's so significant.
High five, Derek. Cat tourniquets. Israeli bandage, chest seals, cat tourniquets, quick clots. I'm so excited.
Do your research on the hospitals too, because if you were in some type of mass casualty event and you needed to rescue yourself, what hospital would you go to? I don't think to look that up. I just go places.
Yeah.
I'm sure I terrify TSA every time I go through the scanner and my backpack goes through. Where's this guy going?
Right? Yeah.
You're just prepared. And there's nothing wrong with preparation. And your experiences have taught you how to be prepared for the situations you may encounter. And then using that experience to teach others only makes the rest of us more prepared for whatever we may encounter as well. So, Derek, we are at the end of our conversation, unfortunately. I always enjoy these conversations and hearing people's stories. But before we go, we want to give you the mic one last time. If you have any other advice or final thoughts you want to share with our audience, we'd love to let you pass that on before we wrap up today.
Oh my gosh. I'm completely unprepared for this part, y'all.
No pressure.
I would probably say this is I hate to say the word cliche, but it's so true. A lot of activities going on throughout the country right now. Something that's so fundamental in emergency management, and you'll hear this from anyone who's been in the industry for a little while. During the event is not the time to exchange business cards. We have to have those relationships in place ahead of time. That goes for the hospital. The hospital, if it's not taken seriously, it will overrun you. The amount of support that's available and understanding how your community partners, your city, county agencies can support you. And also, in a situation, situations that impact hospitals from the community or internally. We had a saying up, in Dallas, Fort Worth, my colleagues there, these are times when we're not in business with each other. We are there for each other. We can compete in any other way, any other time, from the business of our patient population. But when it comes to events like this, it's all hands on deck and we're there to support each other. And it's really something to see when you can work across organizational boundaries and work together for the good of everyone in your community.
Yeah. And that's very good advice to leave on, to remember that in the situations we find ourselves in, it's time to put all that aside and just work together for the common good and for the benefit of the people who need help. So excellent, Derek. Thank you so much for joining us today. I'm very appreciative that you spent some time with us. We really learned a lot.
Thanks for having me.
That was Derek Trabon, Director of Emergency Management at the University of Texas at Austin in Austin, Texas. And Chris, my biggest takeaway is what he said about simulation. When he said that the body can never go where the brain has never been.
That was my biggest takeaway, Melanie.
Well,
I wrote it down.
I did too. I did. And that is so true. With all of the experts that we are going to be talking to this season, so many of them hit on the importance of simulation and the importance of doing, not just discussing. But I don't think I've ever heard it put so eloquently, but so pointedly at the same time. And that really stuck with me when he was talking about how important it is to actually practice.
Yeah. And this man has had more experience in a lifetime than 20 people would. And the fact that he is using that to educate others is amazing. And I'm so grateful that he shared that with us today.
Yeah, we absolutely learned a lot, and he has a lot of life experiences to share. And I do have to include, just as a matter of formality before we wrap this episode up, that the opinions expressed here belong solely to Derek Trabon and do not reflect the views of his employers, past or present. But we enjoyed hearing his experiences, and we have a lot to take away and a lot to think about as we look at our own facilities and our own preparations and planning. But that is going to do it for this week's episode. We've still got so much more to come, so stay tuned. On behalf of Chris, myself, and the whole team here at First Case, thanks for listening to this week's podcast.
Thank you for listening to this week's episode of First Case. As a reminder, you can help support us by subscribing to First Case on your favorite podcast app or by downloading the smartphone app on iPhone or Android. Simply search for First Case in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@firstcasemedia.com. We look forward to hearing from you.